Good afternoon, everyone. We're going to give everyone just a few seconds to continue to gather, and then we're going to get started. Hello, everyone out there. I'm Dr. Dan Salinas. I'm the Chief Medical Officer at Children's Healthcare of Atlanta, and today I'm here with my colleague, Dr. Andy Shane. Dr. Shane is a pediatric infectious disease specialist, and she is our hospital epidemiologist at Children's, and she is head of the Department of Pediatric Infectious Disease at Emory University School of Medicine. We're here to talk to you today about influenza. There is a lot of information that is circulating about the flu this year. This has been a very busy flu season. We've heard from a lot of our families that many of you feel scared and you feel helpless. And what we want to do today is to empower you and arm you with facts about influenza to help you take good care of your kids, to help you feel secure about taking good care of your kids, and just to give you the empowerment to be able to say to you, you got this, we know you got this. And so what we're going to do is we're going to share some questions today that we think are going to help you to understand influenza more. And I'll do a question, Dr. Shane will do a question, and we think through these questions we'll be able to impart a lot of really good information to you to help you understand what's going on with the flu. So with that in mind, I'll go ahead and get started with question number one. The first question that many are asking is, how does this flu season compare to past flu seasons? Well, I will tell you this is a very busy respiratory virus season in general here in Metro Atlanta and in the state of Georgia and throughout the country. And we are seeing unprecedented volumes in our emergency departments and a lot of influenza. So the bottom line is we are in the middle of an influenza outbreak. The number of cases of influenza that we're seeing in general are higher than we anticipated and higher than we have seen in the past. And the predominant strain of flu that we're seeing now is influenza A. And this flu, it's also called H3N2, tends to be a little bit worse of an influenza, and that is the main circulating influenza now. Remember, flu it's more serious than the common cold, but we especially don't want you to panic because in a normal, healthy child, influenza is a self-limiting disease. I'm going to turn it over to Dr. Shane for our second question.
Thank you, Dr. Salinas. So our second question is, stories of flu-related deaths seem to be everywhere in the news. Is it safe to say my child is more likely to get a more severe case of flu this season? So what we have seen, even though every case and every death is something to be concerned about, that overall this is about normal for what we see in an influenza season. The challenge is that we have seen more infections, but many of the children that we have been seeing have had mild cases of influenza and have not been required detailed care. Many of these children can be managed at home. Parents know their children the best, and so concerns about some symptoms that we'll discuss later are reasons why a child should be brought for medical care to their pediatrician.
I think a really good question that's associated with that is, when should I take my child to an emergency department? So most importantly, you know your child the best, and the other person that knows your child as well as you do is your child's pediatrician. So our recommendation for most cases of influenza in a normal, otherwise healthy child is to do what you think you should do as a parent, but also seek care through your pediatrician. There might be times, though, when you would come to an emergency department. And what are some of those things that you would look for? If your child has labored, difficult breathing, irritability that's inconsolable, confusion or headache that won't go away, neck stiffness, dehydration, severe back pain, severe joint and muscle pain that's unrelenting, weakness in the legs and feet, red urine, those are the things that we would say would warrant an emergency department visit. But for most cases of influenza, I want to really impress upon you, most of these can be handled at home with what we call symptomatic care. If not, seek your pediatrician, come to one of our urgent care centers and reserve the emergency department for some of the severe conditions that I mentioned earlier.
Thanks, Dan. And I think another related question is, does my child need to be tested for the flu, and does he need antiviral medication? So during the influenza season, which is currently what we're seeing, the predominant circulating virus is influenza. There are other respiratory viruses, but once again, we want to help parents to understand that they should base whether or not a child needs evaluation, and that includes testing and or treatment on their child's condition. And so most children who have a fever, runny nose, and a cough, the three main symptoms of a flu infection, do not need to be tested and do not need antiviral medication. Those who may need evaluation by their pediatrician include children who have an underlying medical condition, such as a respiratory problem, asthma, or any problem with their immune system that may predispose them to having a more severe influenza infection.
Thank you, Dr. Shane. This next question that we surfaced is really, really important, and it's the following. Should I give my child aspirin to reduce fever? The answer to that is no. Aspirin and aspirin-containing products should really not be given to any child with suspected influenza. In general, for fever reduction, we recommend acetaminophen, or Tylenol as it's commonly called, and ibuprofen or Advil to reduce the fever. But please avoid aspirin and aspirin-containing products in your child if you think they have influenza. Dr. Shane?
Thank you, Dan. So another question is, how long should you stay home after getting flu to prevent spreading it to others? And this is a question that we've received quite a lot, because obviously one does not want to have the risk of transmitting the infection to others in the community. And so what we recommend is that a child remain at home until 24 hours after having a fever without the use of fever-lowering medications. And also, we want the child to be able to participate in activities if they're returning to childcare or if they're returning to school. So once again, that's 24 hours without a fever, without the use of fever-reducing medications.
Thank you. That's such an important point. A very important question here. Has the flu season peaked? How long is this going to last? It's really hard to know if flu season has peaked. And what's more, in general, there are up to 4 different kinds of flu viruses that can circulate in this given flu season. While we have been seeing predominantly influenza A, we are starting to see a little bit of a decrease in the number of positive lab specimens for influenza A, but we're starting to see an uptick in cases of influenza B. So has flu season peaked? The answer is no. In general, flu season lasts through mid-April. This season started about 2 weeks early, so we are hoping, as I'm sure you are, that this will let up and that it'll even end a couple of weeks early. But a couple things to remember: it's never too late to get the flu vaccine. And remember, if my child had the flu, can they get another flu? Absolutely. If they didn't get the vaccine, they get the flu, they should still be vaccinated. It's still the #1 line of defense.
Thanks, Dan. And I think you also covered a little bit of that in the next question, which was, can a person who's had the flu get it again in the same season? And so they can get a influenza infection, as you mentioned, with a different strain of the flu virus that may be circulating. And I also wanted to just add to your previous comments, one of the challenges with influenza is it is completely unpredictable. And so we even though we try to predict based on other seasons, for example, this season, it started a little bit earlier, we saw the increase in infection. So we really do respect the flu since it is so unpredictable. Thank you,
Andy. How can I best protect my family? This is such an important question. It really gets to the core of empowering you as parents of children, because we care so deeply about our kids. As we both mentioned, the best way you can protect your family is to make sure that all of you have had the flu vaccine. Very, very important. But then there are some other things that you can do. You can teach your kids how to sneeze properly. That is, how to sneeze into their elbow like that, as opposed to sneezing in their hands. It does reduce the transmission of viruses, flu and cold viruses. Very importantly, take care of yourselves. Take care of your children. Make sure they're getting the right things to eat, the right amount of sleep, the right amount of fluid, things like that. And remember to keep non-toxic hand sanitizers and surface wipes and things like that available. Public surface things like telephones and pens and grocery carts and things like that, please don't hesitate. Please wipe those things down. Wash your hands often. Make sure your children are washing their hands often. These are some of the very simple things that you all can do at home to help prevent the transmission of flu. And also, once again, it empowers you as parents. These are the things that I can do to keep my child well. And that wraps up our session. I wanted to call your attention to a couple of things. We want you to be armed with good information. So you can visit www.choa.org/flu to find a host of resources for you and your family. And also, thank you all for your comments and questions. And you can continue this conversation using the comments section. In fact, we would greatly appreciate to understand where your heads are, if you will, and what we can do to continue to help you. We are here to help you. We're here to support you. And Dr. Shane, thank you. And this concludes our question and answer session. Thank you again for joining us.